I want you to talk to me about a couple of things. If you know how this happened, and specifically when it happened, because I'm going to be thinking as you're talking about tissue healing mechanics, about the level of activity that you want to return to quickly, which is a really, really high level of performance. And what I think you did, based on everybody who's chirped me already about you have no idea, it was so funny. As soon as you got hurt, my phone started going ding, 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 ding. I'm like, what is going on? Like, oh my God, JJ's hurt. You have to take care of him. Please, can you see him? When can you see him? He's the heart of the team. We can't win without him. Oh my God. And I was like, who is this guy? So now he's sitting right in front of me. And so I have a professional sense of duty and urgency to take care of you for the sake of all the people that have been hammering my phone, like, please take care of JJ for us. So tell me a little bit about specifically when it happened, the date, how many days it's been, and what you remember from the injury.
Well, it happened last Friday. Yeah,
Okay.
Friday.
And we're a Wednesday, so Friday, Saturday, Sunday, Monday, Tuesday, Wednesday, exactly 6 days ago? Okay.
And then I don't think it happened like in a specific time. It was kind of just after the game. I think the adrenaline kind of just like maxed it. So as soon as the game was over, I was just walking around, and then it started to feel like kind of just like a Charlie horse. Yeah, I was just like, it was a little sore. Like it's hard to walk, but like a Charlie horse, but like on my calf. And then I kind of just started like limping, and then the next day I felt it a lot more. Like I couldn't like go up on my tippy toes. Like,
Couldn't flex the muscle.
Yeah, couldn't flex it.
Okay, so you don't remember a specific incident during that game where you felt a pop or a snap or a tear or anything like that, and you never went down, you played the whole game?
Yeah.
Awesome, full bore, no limitations.
Yeah.
And then after the game, okay, this is good news. Couple of other questions, just to clarify a couple of things. Did you notice or have you noticed any bruising, either in your calf or down in your foot, in your arch of your foot or any place like that? Not at all. Okay, wonderful. What symptoms are you having now, 6 days later?
Right now it's kind of just like, it feels like really tight a lot of the time. And when I start walking on it, it feels like tighter. And then like if I walk on it like normally kind of, then I start to feel pain after a while.
So when you say walk on it normally, you mean like take a full stride and kind of try to push off your toe, that kind of a thing? Okay, so I'm going to kind of go in a couple of different directions here for your sake and for your dad's sake, just educationally. You're 17 years old, you're a high-level basketball player, and this happened after a full game. Okay, so what most likely has happened is this is an injury, we'll call it in air quotes, because you didn't remember an injury. That is the result of excessive use and fatigue. Okay, the gastrocnemius, the calf muscle that you're pointing to and that you have injured, it's got a large proportion of fast twitch muscle fibers, which means it's susceptible to eccentric injury. Okay, very strong, but susceptible to injury over a long game. And you play at a very elite level. So eccentric loading is when the muscle is lengthening and having to produce force. You're rapidly decelerating, you're accelerating, you're changing directions, et cetera, et cetera. I don't know what your feet look like, but we're going to take a look. Maybe you've got high arches, maybe you've got low arches, I don't know, and you don't have the adequate support. Do you tape up? Do you tape your ankles?
No.
Not at all. Okay. Do you stretch and get real warm before you get out there and play, or not so much?
I
can already tell you don't. You don't stretch?
No.
Dude, really? Not at all? And your coaches don't have you guys stretch?
I mean, we do like the warm up, but that's kind of not like stretching. It's just getting our body warm.
But no formal stretching? Wow. Okay, that's got to change for you. But, particularly if you want to continue to play high-level elite basketball. So, LeBron James, for example, spends over $1 million a year just taking care of his body. Did you know that?
Yeah.
You knew that. Everybody knows that, right? Okay. So if you're going to play elite level basketball, you got to start behaving like an elite level athlete. And not stretching, not elite level. Okay, so for your eval today, here's how we're going to start. I'm going to ask you to take off your shoes. You can leave your socks on, that's fine. I'm I'm gonna do what we call a gait analysis. I'm just gonna watch you walk up and down the hallway. I don't want you to try to walk normally. I want you to try to walk the way that you've been walking to accommodate for this pain and this discomfort. When you come back in the room, I'm gonna have you go through some active motion, okay? And I'll assess your movement, and then we'll put you up on the exam table and we'll do a specific exam for your calf, okay? Questions at all so far?
No, yeah, as far as like the overuse, because it's German, so you did play Thursday.
Friday.
And couldn't play Saturday, so.
Yeah, so all day Thursday, all day Friday, and then Saturday you woke up and you're like, oh my God, what happened? Yeah. So mechanisms, injuries like this have two, sort of primary mechanisms. Either you go out and you try to do a brand new activity that you've never done before, or you do the same thing that you're very well conditioned to do, you just do a lot more of it. And I think that's what probably happened to you. It was just too much, man. All in one shot. And I know you, just based on all the people chirping me about you, like, you're the man. And that's okay. You got everybody counting on you. You're the guy out there yelling, screaming, pulling the team together, and you don't quit. And you probably, maybe you noticed a little something during the game and you were just able to override it and ignore it. And you played all day the previous day and all day the second day, and then the third day, oh dude, I can't walk, Dad. What's going on? So I don't think this is extraordinarily serious, and that's why you're here. We don't want it to get extraordinarily serious. We want you to get back out there as quickly as possible, okay? Go ahead and slip your shoes off. All right, just hang it right, and I'm just gonna watch it down and back, okay? All the way down to the end of the hall and then back to me. Okay, so that's great, and as well as I know, because I can see it, you're landing with a flat foot, and you're not allowing your foot to move up toward the forefoot. You're not even allowing your toes to break at all. You're picking the foot up flat and you're setting it down flat because you don't want any tension going through that calf. Okay, so you've got a really nice pain avoidance gait pattern right now, okay? Which is good, that's okay. I don't want you in pain either. All right, so you're gonna stand up here right in front of your dad, facing me, please, okay? And all I'm gonna have you do, widen out your feet just a little bit. If you can, okay? Keep your heels on the ground and just try to drop all the way down here with me like that. Can you do that? Okay, beautiful. Does that hurt your calf at all? Nothing. Okay, fantastic. Come on up. Okay, not with the injured side, okay, but with the non-injured side. So with your left leg, I just want you to come forward, do a lunge, and come on back up out of it. Are you okay there? Good. Okay, I'm gonna take both of your hands on this one, okay? Try to do that same thing on the right leg. Come on up. Nice. Did that hurt you? Okay, fantastic. Zero, zip, zilch, nada? Nothing? Okay, put your hands in mine. Okay, you can push as much as you need to, okay? All I want you to do is just very gently try to bring your heels up and push on me if you have to, okay? Push as much as you need on my arms. Is that killing you?
No, it just feels tight.
Okay, perfect, good. You're actually way better than I thought you were gonna be. You're not so bad, not at all. This is good. All right, so Jose, if you have any questions at any time, please fire away, okay? All right, partner, that's just to kind of catch your face. Go ahead and lie down on your stomach for me. Beautiful, okay. Pick up both feet, and then set them down for me. Good, okay. Are you comfortable there?
Yeah.
You're okay? So sometimes when we look at a calf, we're going to consider the knee joint, we're going to consider the ankle joint, and we're going to consider the hip joint for lots of different reasons. And we're going to try to create a biomechanically efficient system, because you're not just a calf, right? And your calf is caught between two major joint structures, your knee and your ankle. And your calf, believe it or not, has action at your knee. It bends your knee, and it also plantar flexes or pushes your toes down at your ankle, okay? And so depending on the position of your knee, most intramuscular calf injuries happen when you rapidly extend your knee and it goes out straight really fast, or when you rapidly push fast off of your toes. Miles' dad, right? For example, he had an Achilles tendon rupture not too long ago because he took off really fast, sprinting up a hill. And this entire thing just went bam, and it blew apart, and he had to have surgical reconstruction. So these injuries, you're not anywhere near that, of course, but these injuries are more frequent than we'd like to believe. And so I'm starting on your non-involved side, okay? And we're doing a little test to make sure that your calf and your Achilles are perfectly responsive. When I squeeze your calf, I want to see your foot immediately move down, and it does, okay? And then the contour of the muscle, and this is for your benefit and for mine. You feel what I'm feeling, and I feel what I'm feeling, and it's going to feel very different, I think, on the other side. And you and I are both going to be able to give each other some feedback, okay? In this position, can you point your toes toward the ceiling and hold it there for me? Hold it, push. Good. Rest. Okay. Of course, I'm not going to be as aggressive, okay, on your injured side. I just wanted to give you a preview, okay? So please don't be afraid. I'm not going to go at you real hard over here, okay? All right. And you're going to let me know, JJ, very specifically where in your calf. And I'll know, I just want to know that you and I agree in the area or the region that you feel is most uncomfortable or is injured is the same area that I palpate as feeling injured. I'm guessing right here. Right there. Is that exactly where it is? Okay. I'm going to come over a little bit more medial just to check here. Are you okay there? That's fine? Okay. I'm going to sneak back over to where I felt we'll call it a piece of licorice. That's what it kind of feels like inside of your leg, okay? Or a little tightrope. Is that okay there?
Yeah.
That's fine? Okay. And if I come back right there, that's where it is. Okay. How far down your leg does it come?
That's fine right now.
Okay. And how about out to this side here?
Right.
Right there? Okay. So very gently, have you ever done a hamstring curl in the gym?
Yeah.
Okay, so in your mind, think that you're face down on a hamstring curl machine, okay? And try to do a hamstring curl. Does that hurt your calf?
No.
Awesome. Okay, rest. Beautiful. I'm going to bring your leg up to here, okay? Try to do a hamstring curl. Does that hurt your calf? Perfect. Okay. In this position, just very gently try to step on the gas pedal and push my fingers down with your toes. Does that hurt you? Okay, fantastic. So your contractile ability is there, it's just not really robust, okay? You don't have a lot of power because of pain. So I'm going to do the same test that I did on the other side just to rule out. Okay, perfect. Same downgoing foot and ankle. And this doesn't hurt too bad, right?
No.
Okay, awesome. And in this position, are you able to keep your foot there when I let go? Does that bother you?
No.
Okay, hold it there. Does that bother you? Okay, excellent. Rest. Okay, so here's what we're going to do. We're going to cheat the system a little bit, okay? Because I understand biomechanics, and I understand that right now, your ankle doesn't want to move up and down quite a bit when you walk. It's why you're taking a little bit of a shorter stride on this leg. You're taking this itty bitty step when you step forward with the left so that this ankle doesn't have to flex or dorsiflex as much and put length through your calf muscle. What that also means, even though you're not aware, is that this muscle in the front of your right hip is starting to adaptively shorten, okay? So what I'm gonna do first, before I even touch anything down here, I'm gonna stretch out your right hip and then we're gonna go for another walk, okay? So the way that we do that is slide over toward me, toward the edge of the table, and then put this foot down on the floor. Beautiful, JJ. You can take your face out of that hole and turn your face to the right there. Step as far forward as you can with this foot. Beautiful, okay. Stay as relaxed as you can with me. This is going to be a stretch the likes of which you've never had before, okay? So if it's too much, I want you to tap, okay? Tap the table. Stay as relaxed as you can for me and let me move your knee, okay? I'm not going to touch your calf at all, but what we're going to do is we're going to try to give you a little bit more hip extension because right now your ankle doesn't want to give you much of this while you're walking. So because your ankle doesn't want to give you too much dorsiflexion, we're going to give you a little bit more hip extension so that you can take a full stride over here and take a little bit of tension off of the calf, okay? Stay as relaxed as you can. Here comes that big kahuna stretch I was talking about, okay? Here we go. If it's too much, let me know. It should just be in the front of the leg. Okay. You're an athlete and you're tough. I know you can handle it. You good? Okay. So in this position, try to take your knee and drive it to the floor. There you go. And relax, let it go. Excellent. One more time. Relax, let it go. Good. Good? Okay. I'm going to give you a little bit more leverage here just so I can get as much length out of it as I possibly can. And when you come up from this, what I'm hoping is that your leg feels light and loose, and when you go on that same walk, you feel like you can actually take a full step. Okay, come on up. Let's see how you do. Hey, smiling. What the heck? That already looks better. How you feel? Yeah. What do you feel? You can already go all the way? That deserves a fist bump.
Yeah, thank you.
Okay, you're welcome. Come on in. Okay, and I'm going to teach you how to do that stretch for yourself as well, okay? So here's the logic here. So when I watched you walk that first time, when your left leg swung forward, you took a tiny little step and then you picked this up and you carried it because you didn't want to take a full step because then that stretches your calf, right? So what did I do? I took this hip and I gave it a lot more of this, okay? So that now your hip can move back further. Your ankle, relatively speaking, doesn't have to flex up as high because you have more motion here now, okay? And it took a little bit of the tension off of your calf muscle. Okay, that's what I meant by cheating your body a little bit, okay? It's just mechanics, that's all it is, okay? So what we're gonna do next is a mobilization at your ankle. I'm saving you the tissue work for last, okay? That's the kind of the final magic sprinkles on the cupcake, okay? I'm gonna loosen up your ankle joint now because for a week you've been going like this and you've been carrying your foot flat, which means that this joint, called the talocrural joint, has stiffened up a little bit, okay? So you're gonna lie on your back with both feet hanging off the edge of the table, please. There you go, there's a pillow for your head. Beautiful, okay, excellent. Are you a senior, JJ?
Yeah.
What's the plan for after high school?
We'll see after the season if I'll go anywhere, but if not.
Where would you like to go? Slide up for me a little tiny bit, slide up this way towards your head. There you go.
It doesn't really matter to me. Anywhere that I best opportunity.
Nice.
Or just better.
Okay, so you see what I'm doing to your ankle? And again, I'm starting on the non-involved side, so you know what to expect, okay? Because I know there might be a little bit of fear going on in your mind, like what is this monster gonna do to my leg? Okay. Here we go. We're just gonna mobilize. This is a little bone in here called the talus. It's the only bone in the body that there's no muscles that attach to it. It kind of floats in there, and it's stuck between these two bones, your tibia and your fibula. And it allows your foot to do this, okay? So I'm taking the web space in my hand right on top of that little bone and pushing it backward so that when you get up to walk, your ankle can do this a little bit more freely at the level of the joint, okay? The last thing we're gonna do is stretch you, okay? We don't wanna overstretch because that's what's gonna hurt you the most. Okay, stay as relaxed as you can. And what we're going to do now is we're going to take your foot. Boom! Did you feel that little pop in there? Okay. I don't know why that always makes people laugh when they hear the big pow come out of their ankle. No matter men, women, kids. I noticed the first thing he did when he sat down in front of me, his hands. I was thinking, whoa, he must be nervous. All right, you okay?
Yeah.
All right, so one treatment, reassess. Go for the walk. We stretched your hip, we reassessed. Immobilized your ankle, we're gonna reassess. How do you feel?
Better.
I'll take better. Good. Yeah, in fact, your gait pattern is,
Yeah, I don't feel like I'm.
you don't have a limp right now
Yeah.
at all. It's good. Okay, so two treatment techniques and you already don't have a limp. Okay, so now we're gonna start the tissue work, which is the part where we're gonna try to lengthen the tissue a little bit, okay? I will use a couple of different techniques The first one is going to be more of a kneading technique, depending on how you tolerate that. Then we'll go to a little bit more of aggressive technique, but they can be a little uncomfortable, so we'll do the best we can. We're going to lie you on your stomach, and we're going to get going. Good, JJ. I'm guessing that you're a junior. Is that right? Okay. No, I mean your name. Sorry, because your dad's Jose, you're JJ, so I'm guessing it's a. Anyway, let's lift up your feet. Okay. All right, buddy, here we go. So, you're okay with that level of force? Yes? Yeah. Okay. And I'm going to come to the other side. Sorry about that, Mark. That's okay. And you're okay with this level of force here? Woo, that's where it's going to be most painful, right there. I can feel that. It's like a great big, right there. Are you okay with that level of pressure?
Yeah.
Okay. So the first thing we're going to do, just very, very generalized kneading to get you used to the pressure. And then we're going to go very specifically into that single area of fiber that feels like it's a rope right there. You feel that? There it is. Bam. I mean, it's very palpable. And that's where everything kind of shortened up on you, okay? But initially, we're going to start from a very, very general footprint. And then we're going to get more specific. Because I don't want you to hate my guts. So far, so good? Okay. This is a little bit of what we call a tack and stretch technique. You okay there? All right. Let me know if anything really bites at you, okay? When is your next, when are you expected to play again?
I'm hoping to play Saturday.
Relax your ankle, buddy. Relax your leg. Let me have all control of your leg, okay? Don't fight with me. Don't push on me. Just do the best you can to relax. Good. You'll feel that I'm purposely moving your ankle up and down to get the muscle to shorten and then lengthen, shorten and then lengthen. Good. Excellent. You okay? Okay. We're going to get a little tiny bit of massage cream in there, and we're going to be very specific now on that area of muscle that doesn't like to be touched. Okay, so if anything I've done to you today is going to hurt at all, it's going to be this, okay? So try to hang in there with me, okay? You doing all right? Okay, if it's too much, you say so, all right? I'm not being real aggressive, at least not yet. Remember, when we treat patients, we don't want to go right to our most powerful tool. And so very, very gently, I'm stepping up the different techniques that we're exposing you to and reassessing after each one to see which of them gives you the most relief. That's the one we're going to stick with, okay? I'm guessing you've been icing at home?
Yeah.
Or heating? Okay. Anti-inflammatories? You take an Advil or anything like that?
No.
Okay. And have you been stretching?
No.
Good. Not yet. I'm going to do that for you in just a minute. That's what I had explained. We're going to leave that till the very end, the very last. So if I get in there real deep now, on a scale of 1 to 10, how's that pain?
Like
5? Okay. And is it a 5 throughout all of these different regions? Or does it change? Okay, so right down in here starts to get worse?
Yeah.
Okay. All right. I am going to take a closer look at your feet because this is a pretty far lateral injury, meaning it's pretty far to the outside of your gastroc, your calf muscle. And I'm sure you're already aware of this, but you have a little bit of what we call genuvarum, your knees bow out a little bit on both sides, okay? Which is gonna put you at a little bit of a predisposition to have an injury like this, okay? Just based on your anatomy. And so if I can do anything corrective at your feet, I can slacken this for you, I will, okay?
That's the one that's not injured, right?
Correct.
So you're just trying to get the same threshold.
I'm working him through because he's getting ready for a treat on his right side. Always start on the non-involved side. Always. No. Always. We always start on the non-involved side. Always. All right. You ready?
Yeah.
Okay. He was just liking it too much. He didn't want to tell me. No. I know. And that's exactly why we're... JJ, where are you?
Right now, it's not too bad.
You don't have to lie. Okay, so if I come medial, if I come the inside, is that fine?
Yeah.
Okay, if I come right up the middle, we're gonna do it exactly like we did the other side. Right here. Okay, and there. Do you feel, because I do, I feel like you're a little bit more swollen on this side. It is, and I can feel it, and here, on this side scale of 1 to 10, are we still a 6?
No, 7.
7, okay. All right, stay as relaxed as you can. Is this a little easier if we do it that way? Okay. Remember, give me your leg, totally relax. Good. All the same techniques that we demonstrated on the left side, okay? Good. Is this your first ever sort of setback physically? Okay. Did that one bruise up at all? Turn black and blue or green? Okay.
You got pushed from behind and it stretched.
Ouch.
First landing football. It was a 5 football.
Okay. So when I got your call back, I was confused because it said DJ booth or something, and I thought,
Oh yeah, that's
who?
my brother and I own the DJ booth.
Oh, cool.
Yeah.
That's fun.
Yeah.
You guys must be busy.
During the holidays.
Sure.
Yeah, first just around Monterey Street.
Is DJing a passion of yours, or is it more of a hobby?
No, that's my brother.
Your brother's. Okay.
Yeah, I'm just more of a fan.
You're the bankroll.
Yeah,
Yeah. Understood. JJ, am I killing you, or are you okay? All right.
We did use the tennis mat.
Okay, good.
But the first day, it was sensitive to the touch.
Oh, for sure.
Was that still a good process?
It's a great process, and it desensitizes him to the pain. So it's not going to necessarily accelerate the tissue healing, but it will decrease his what we call nociceptive threshold. So you and I have a certain threshold. If we touch a hot burner, we want to yank our fingers away. Well, with something like this, exposure to that TENS unit will decrease the excitability of his pain receptors. So he won't feel pain as robustly the more exposure he has to that TENS unit. Sure. Oh, believe me, I'm not lying when I told you my phone was blowing up. You gotta see him, please. How many more games do you guys have? Okay. I understand you've been a starter all 4 years. Okay. Yeah, you're a heck of a ball player. And you're humble too. That's good rearing, Dad. Oh, sure. All right, bud. Scale of 1 to 10. Still. Oh, turn off the hamstring. There you go. There's no way I'm fighting with a hamstring like yours. Maybe if you were 7 years old, but not yours. So the fact that you can actually tolerate this now is good. It's really good. Are you grimacing or crying down there, or are you okay? All right, good. And did you get a wrap or a sleeve or anything like that, or did you try an ace wrap or anything? Compression? Okay. Okay. And did it help?
Yeah, I felt a little better.
Okay. It wasn't terrible. Okay. Let's see how he does today. There are a couple of different techniques that we can use with athletic tape to actually slacken the tissue so that he can't get it to a max length and injure it again. But it's going to be restrictive, and I don't know that we want him playing bound up like that and restricted. Come on up, let's go for that same walk, same reassessment after 7 out of 10 tissue work pain. Hey, he's pushing off of it, look at that. You're actually coming up, hey Jim, you're actually coming off your toes. So percentage improvement, in your opinion, what do you think? Yeah. 80%, okay. We'll take it. Okay. So what we're going to do next, on the next one, I'll have you come out and watch. You can actually see his calf muscle contract now because he's pushing and he's not just picking his foot up and setting it down, which is nice. Okay, JJ, we're going to line you up again with your body and your right leg on the table and your left foot on the floor. Remember for that big, horrible hip stretch? There you go. Perfect. Okay. Slide back down toward me just a hair. Perfect. Okay. Good. And then after this, I'm going to teach you a few different ways for you to do this by yourself, okay? I cannot believe that your coach or do you guys have a trainer? Like no stretching before basketball? That's just insane to me. Who's the head coach? Brian. Okay, I know Brian. We all know Brian. He's a good guy. He's intense. He wants it. He wants it. All right, so I'm going to introduce a little bit of rotation here. Okay, and then we're going to bring hip extension in. Okay. Oh, don't run away from me. Come back here. All right. And I know that's a brutal stretch. You okay? I can't see your face, so if you need to tap, you let me know. I can back off anytime, okay? I have, like I said before, I've got what feels like the entire community staring at me right now like, get him back on the court, man. I'm like, okay, guys, no pressure. So we're going to do everything we can, okay? The one thing I won't ever do is tell you I think you can go back if I really don't feel like you can, okay? Because your health is way more important than anything else. And if you've got the whole season ahead of you, 2-3 games is not going to make a big deal or a big difference, okay? Come on back. Jose, come on, take a look at him, walk down the hall, and you tell me what you think as well. You've been watching him hobble around for a while. Oh.
Yeah, he's actually bending his leg.
Yeah, his foot's coming up. It's nice, his heel's coming up. How do you feel? Okay, so without me, because before you were pushing on me, but without me, are you able to do that? And?
Just a little bit, even not small.
Okay. All right, we're making progress. So one of the things that we can do, I know it's the week before the holiday and all that stuff, and everybody's schedules are insane, but I'll figure out a way maybe to see you. Today's Wednesday. I'll figure out a way to see you maybe tomorrow and Friday, and if not tomorrow, Friday, and we'll get 2 in this week, just so we can really make some progress. On your back. Okay, last one. I'm going to do this first on your left, okay, just like we did everything else first on your left, and then you're going to kind of understand what's coming so that you can relax. Remember the little pop that we did in your ankle previously?
Yes.
Okay, so I'm going to take that same little bone right here, the talus, I'm going to push it back, okay? Then I'm going to apply leverage through you. And that's a calf stretch probably the likes of which you've never had before. Like, oh God, again. Okay, so breathe, and of course I'm not going to be this aggressive on your injured side, okay? Of course I'm not. But if we're going to stretch, we're going to stretch, okay? We're not here to mess around. We're here to get you back out there playing without limitations, okay? You're in the right place and you're with the right guy, but it means you and I are going to have a love-hate relationship. All right. Yeah, when we get you back, man, I want an autographed picture. I can put you up on our wall of fame back there.
I don't think I'm at that caliber yet.
Of course you are. You have team photos, don't you? Okay.
Maybe one.
Stay as relaxed as you can, okay? We're going to push that bone back, okay? And then very gently, you tell me when to stop. I want this to be about a 6 out of 10 stretch, not a 10 out of 10 stretch.
Like that.
Okay. Now, is that painful or is it just a stretch?
Just like
It's just right before pain, or did we already go past pain?
right before.
Good, good, good. Perfect. We're going to do some eccentric loading to finish up tonight in just a moment. Okay. Mr. No Stretching, we're going to... Yeah, you're right, you don't stretch. Oh, man. Where do you feel that?
Everywhere.
Okay.
All right.
It's a good answer. Shouldn't feel that in your calf at all.
No.
Good. Well, honestly, like, so for every 1 degree rise in a muscle's temperature, its sustainable power output increases by about 3 times. One of the best ways to gently warm up a muscle after you've done your cursory warm up, you're out there lightly dribbling, taking some layups and some free throws and some shots, is to stretch. You can actually warm up a muscle by stretching it, okay? And decrease your chances of having another injury like this. So the warm-up is great, but a really nice functional stretching routine is even better, okay? I mean, maybe they assume that you guys are doing it on your own, but you know, if I'm responsible to protect the health and well-being and strength and power production of a bunch of young, I mean, this might, don't take offense at this, but you are still neuromusculoskeletally immature. I know you're 17, but you're not 100% done filling out and growing yet. So it's really important, man, that you get a very, very nice warm up and stretch before you really engage. The example I like to give, you ever watch the track and field Olympics?
Sometimes, yeah.
Okay, so I love watching the sprinters. And when they take the blocks, particularly like the 100 meters and the 200 meter runners, it's awesome. Like when they show that shot of all of them lined up in the blocks, you can see the sweat just pouring off their shoulders and dripping off their heads. And I mean, they're like engines that have been really hot and warmed up for a while, because when that gun goes off, man, if they're not warm, hamstrings are popping, calves are popping, you know, hernias are happening. I mean, they gotta be really warm and really well stretched. And they take maybe 5, 6, 7 practice starts before they actually start for their race. So they're doing the activity at a high level before they actually have to compete, okay? Come on up, go for a walk. I know it's kind of boring, the treat, walk, but we call it treat, reassess, treat, reassess. It's very, very important for us, because if something's not working, we're not gonna hang on to it. Awesome, I don't see any gait deviation right now, none. Taking a full stride too. How's it feel?
Good, just like still a little tight there.
Yeah, that's okay. All right, so last little test here with me. Put your hands on mine. I just want to see how much you actually push. Do a couple of bilateral heel raises. Dad, can you see his calf contracting just like the other one?
Yeah.
Okay, how's it feel?
Just a little, I can feel it different, but it's like not too much.
Okay. On a scale of 1 to 10, pain-wise, where is it?
Pain's like
3? Okay, and then as a percentage of improvement since we started tonight, where are you? 85%. Okay, I'll take 85% after one visit, all day long. Okay, that's good stuff. So the last thing I'm going to do with you is I'm going to eccentrically load your calf muscle, meaning I'm going to challenge it under length, and then I'm going to teach you how to stretch your hip and your hamstring. Then we're done, okay? And all I want you to do until I see you again on Friday is stretch your hip a lot, stretch your hamstring a lot, okay? That's it. All right, got it? Okay, so have a seat here, and your ankle's going to be here, and your foot's going to be hanging off the edge of the table there. Perfect. Okay. So what we're going to do here is stay sitting up for me, and you can put your hands, just grab the table here. There you go, perfect. So in this position, what I'm going to do, you're going to point your toe, and then you're going to just, as best you can, you and I are not trying to beat each other here, okay? We're trying to meet each other here, okay? I'm going to try to bring your foot up like this, and all you're going to do is slow me down. You're going to allow me to move you, but you're going to just gently slow me down, okay? So totally relax. It's just totally relaxed. Don't give me any resistance. It's gonna look like this. Here and then back. Here and then back. That's all we're doing, okay? And you're not allowing me to take you into pain, okay? You're literally just gonna slow me down, relax. Slow me down, relax. Slow me down, relax. Does that sound like a broken record yet? Do you know what we're doing?
Yeah.
Okay, here we go.
Slow you down and relax.
Yes, here we go. On 3. 1, 2, 3, go. Slow me down, let me move you. Relax. 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 Good. Keep going. Slow me down, let me move you. Eventually we'll be doing this on our leg press outside, but not today. I'm getting to know your body and getting to know where your endpoints are before we actually put you on a program out there. Okay, slow me down. Relax. Slow me down. Relax. Slow me down. Relax. Slow me down. And of course, I can't recreate the kind of forces with one arm that you are putting through this thing out on the basketball court. That's an impossibility. You know, you come down from a jump, you land hard, you fly off the ground, you land on one foot, you pivot, you know, you start, you stop. Those forces are massive, okay? But we can test you out in the clinic before we give you the nod to go back, okay? A couple more. Okay, one more. Slow me down. And that's not killing you, right? Sweet. Okay, lie on your back. So this is your hamstring stretch. Hamstring's a 2-joint muscle, okay? Which means hamstring extends your hip and it also flexes your knee. So to stretch a hamstring well, you need to flex your hip first, grab the back of your thigh with 2 hands, hold it into your chest, and then try to extend your leg up that way. Keep this flexed and down. You can do it like that, okay? Or if it's more comfortable, or if it's easier, or if you just prefer it, you can lasso your foot with a towel. Don't flex your ankle, of course, but you can pull that way until you create that stretch. Which one did you get a better stretch with? Okay, then you stick with that way. Hold it down, push that way with your foot. Keep this flexed and down. And what you'll notice is if you let this go, turn off your quad, turn off the quad, turn off the quad. Notice how that stretch goes away? Now tighten the quad and you notice how that stretch comes back? Okay, you got to do this, okay, because that's how your body behaves. When you're on the court and you're running and this leg is driving forward and that leg is driving backward, there's a counter stretch because your pelvis is rotating in opposite directions. You have to stretch the same way. Otherwise, it's not a functional stretch, okay? And again, these are static stretches, which for a guy like you are not the best, but you're fresh off of a terrible injury and we're gonna start you slow, okay? Other side. And this is much better than you just sitting around doing nothing, okay? Thigh to chest, hold, fire this quad, push that foot up through that wall. Good. And again, how long to hold the stretch? Until the initial intensity that you feel starts to fade a little bit, okay? Was there any questions? That's a great question. When are you guys in the gym warming up pre-game? An hour?
No, we get there after like halftime. Or not at the start of games, like 5:45ish.
And you start what time? 7? Okay, so you're there a little more than an hour. And what are you guys doing with all that time?
Just sitting around watching like JV.
Okay. You know what you're gonna do? You're gonna put a full sweatsuit on and a beanie. You're gonna, I'm serious, and you're gonna go out to the track and you're gonna walk, okay? You're gonna walk until you get a sweat on. And then when you get a sweat on, you're gonna fast walk a lap. And then after you fast walk a lap, you're gonna just gentle jog a lap, okay? Not sprint, just gentle jog a lap. And then after that, you're gonna do your stretching, okay? And I'll take you through a stretching program. This is gonna be one of them, but I'd like to get you to some dynamic stretches. I mean, when I mean dynamic stretch, you know, is we're gonna, stuff like this eventually, okay? Not right now, okay? Not yet. Come on up. Okay, you're gonna take a knee, this is just a pad, face me, and you're gonna put your right knee right here, okay? All right, so the stretch that I put on you on this table that when you got up and you were like, whoa, you know, okay. The way that you do that, use this for balance, okay? Here, let's scoot you forward toward the table a little bit. There you go. You're gonna be up real tall. Imagine you got a dowel through your hips and you can't move this way at all, okay? But you can tuck your pelvis around the dowel. Stay up tall here. Pull your belly button up toward your chin. Kind of tuck your hips under. Listen to my hands. There, bam. You feel that already in the front of the hip?
Yeah.
Maintain that. It's called a pelvic tilt, a posterior pelvic tilt. Keep it. Now squeeze this tush. Tighten up your butt cheek here. Nice. You feel that right there?
Yeah.
Okay, now lean away. And you're gonna feel a big pull right here. So it's here, tuck, squeeze, and lean away. Should be right in the front of that hip, right where the pocket for your jeans would be. And maintain it again until that initial intensity begins to fade. And this is part of restoring the mechanics when you walk, and particularly when you run. Your calf injury is not bad. Very painful, yes, but not terrible, okay? You'll be back sooner than you think, but let's do it right. Okay, switch sides. And you may need to face your dad if you want to use the table for balance. Good. So it's up tall, pelvic tilt first, belly button towards your chin, squeeze this tush, and lean away, and you should feel the stretch right there, okay? And you feel how tight that is? Shouldn't be that tight, okay?
Years of not stretching?
Well, sure, and sitting in a desk for 6-7 hours a day, this whole muscle complex is in a shortened position, and then he's got to stand, and now it has to lengthen, and now he's got to play, and it's got to lengthen even more. If he doesn't have the length, he's going to get it from somewhere else, and unfortunately, he got it from his calf. He took it from his calf. Oh, stop! Don't take it that far, buddy. Don't take it that far. I still have to sit at my desk quite a bit, but I put in my time. I put in my stretching time.
Always finds the loopholes.
Don't go to school on game days, is what he said.
He's got a good sense of humor, doesn't he? As you get older, you'll find out that these kinds of things will help you not feel so old as time ticks off the clock, okay? Come on up and go for that same walk again. Jose, have a look at him and tell me what you think, and we'll get a good read on what we're gonna do next. You're gonna have to edit out that part when I was on the wrong way doing the tissue work. Oh my God. When I was on his left calf doing all the tissue work and it was the wrong side until his dad said, hey, isn't that the wrong leg? And I was like, oh my God.
I actually like that because your legs, you gotta work both sides, right?
How's it feel?
Good.
How's it look?
He looked a lot better. He's actually walking tall.
Okay, percentage improvement, day 1. Okay, so what we'll add on Friday, we'll go out to the gym a little bit and we'll add some of our equipment, some of our exercises. We'll take you to the back gym and I'll challenge you a little bit more. I'll probably focus at your hips and your quads. I won't yet focus down at your calf muscles, but we'll start to gradually increase intensity and get you to some plyometrics eventually, which is the highest level of activity before we would say, all right, go ahead and go back. Meaning, you know, raise this exam table up as high as it'll go and see if you can jump up onto it, you know, stuff like that. It's high level, but definitely not ready for that right now, okay? Your progress is not gonna look like that. It's gonna look like this, okay? By design. This is still healing. It's only 6 days old and you were barely able to walk, right? Okay, and it hurt like hell, right?
Yeah.
And now it's 85% better after just 1 treatment session. Let's not mess with that, okay? Don't go home and go, dude, I'm gonna go shoot some hoop because I feel better. I saw a PT, he's a miracle worker, I'm 85%. Don't do that, okay? Please don't do that. I don't want you to set back, okay? I want you to keep moving forward, keep moving forward, keep moving forward. And when you do go back, you're solid, okay? Is there a chance that it could happen again? Sure. It's like somebody that takes a year off to recover and do their rehab after an ACL reconstruction, and the poor kid re-tears it. It happens, okay? I want to minimize the chance that this is going to happen to you again, okay? So even if you're feeling really good tonight, chill, okay? Hamstring stretch, hip stretch, you got them?
Yeah.
Okay, questions?
For that.
I'm going to ask 4 or 5 times a day, each of those, okay? And 30, 40 seconds a piece. Get nice and loose. Don't stretch your calves yet. Don't need to do that yet. I'll do that for you for now, okay? And your stretches for the calves are going to be more functional with activity rather than just static here in the clinic, okay? Questions?
Morning, midday.
Anytime he wants to do them. But yeah, in a perfect world, sure. Morning, mid-morning, afternoon, mid-afternoon, evening, sure. But given their schedules, who knows how he's going to be able to make it work.
Well, yeah. Luckily, today was first day of finals, so he's out at
Nice. Okay. Yeah, my girls have finals today too. I can't wait to get home tonight and find out how they're doing and hear all about it. They were dreading. My oldest was dreading her physics final. Like, oh, like yeah, I wouldn't be looking forward to a physics final either. No thanks. JJ, it was really nice to meet you. Pleasure. Jose, my pleasure. Yeah, my pleasure.